We will go ahead and get started. I know there'll be a few more folks joining. Welcome. I am Hannah Gilbert. I am the director of ABSAC, and I'm thrilled to have you all here this month during Child Abuse Prevention Month for our journey through child abuse prevention. Today, we are diving into secondary prevention with Rhonda Newton, who is the CEO of Darkness to Light. I want to remind you that we have two more a part of the series. We have tertiary prevention next week with Dr. Cheryl Langtree. And then we have Universal Prevention, Creating a Culture of Child Safety, April 30th with Stacy LeBlanc. Many of you are ABSAC members. If not, we are the American Professional Society on the Abuse of Children. We are a membership society with all different disciplines. Definitely encourage you to join, take advantage of member benefits, including free and discounted training, section only for members, resources, and much, much more. And lastly, we do have our annual colloquium coming up in New Orleans, June 9th through 13th with 13 different tracks. There is a prevention track. Encourage you to sign up and register today. And then I am going to go ahead and introduce our fabulous speaker today, Rhonda Newton, who is CEO and Senior Director of Curriculum, joined Darkness to Light in September 2020 as the team's Director of Curriculum Design. In this role, she's responsible for advancing the scale and impact of Darkness to Light's prevention work by increasing the current course catalog of adult-focused training. She assesses new technologies, researches adult learning trends, and works with a variety of stakeholders across departments to analyze requirements needed to meet learning objectives and behavior change targets. Rhonda brings with her over a decade of experience as an educator, curriculum specialist, and instructional designer at both the K-12 and university level. She has her BA in French and Spanish and MED in Learning and Technology, and is a current PhD candidate. And her research is centered around game-based learning and pro-social skill development. Rhonda is a passionate individual with a personal mission to create safe, welcoming spaces for all individuals, whether that's virtually or in real life. And I will remind you that this is recorded. We will have Q&A at the end, so please throughout put your questions in the chat, any comments, anything that you want to share, and I will go ahead and pass it on to Rhonda. And thank you so much for joining us.
Thank you so much, Hannah. So I am going to go ahead and share my screen. Um, so like Hannah said, I'm CEO at Darkness to Light, and it really is my pleasure to present at this session and be with you all today. Just to get us started, I wanted to briefly introduce my organization for those of you who may not have heard of us before. So Darkness to Light is a national nonprofit, and we're committed to empowering adults to prevent child sexual abuse. We believe that protecting children is an adult's responsibility, and that it's through education and training adults will be empowered to act. Since our founding in 2000, more than 2.2 million adults have been trained in our flagship program, Stewards of Children, which is facilitated across the world by over 12,000 committed volunteers. Our work empowers adults and organizations to bring the best policies and practices in child safety into their own communities. So like Hannah had stated, I'm an instructional designer at the core. So I want to prepare you for what is coming in this presentation by sharing the learning objectives for this session. We have 4 anchoring objectives. So by the end of the session, we should be able to identify the factors that contribute to the vulnerability of populations and those factors that also place families at risk. We're going to look at discussing ways to strengthen early intervention programs and support services, and look at what does trauma-informed care mean and highlight how you can use those intervention techniques, and then finally reflect on ways to collaborate between groups, institutional groups, and entities like social services, healthcare, educational institutions. So let's dive straight into it. And first and foremost, just to begin the conversation, we talk about prevalence and impact. And I'm pretty sure if you've attended the session prior to this week, you may have seen some of this before. The statistic that we use, and you can see the source listed there, is 1 in 10 children will be sexually abused by their 18th birthday. However, depending on the studies quoted and depending on the definition of child sexual abuse that is used, so does it include data that span non-contact abuse or both non-contact and contact, these numbers and the statistic might differ. but we all know many cases go unreported. So gauging even the prevalence is complex. The CDC has a report out by Pareda, Aguilera, Forms, and Gomez, and I think that was around 2009, and they cited 1 in 4 girls and 1 in 13 boys, for example. But the fact remains that the numbers may be underestimated due to the underreporting and stigma. What we know is that prevalence of child sexual abuse, though it may vary across different populations and settings, it occurs in all socioeconomic, racial, and ethnic groups. And it could take many forms, right? Including, but not limited to, physical contact, non contact abuse, and even online exploitation. So I know this group before me. I don't think we need to go into all of the ways that the impact of child sexual abuse can manifest. I'm pretty sure that we've heard the whole gamut, right? The anxiety, depression, PTSD, low self-esteem, all of the self-harm, suicidal ideation. What is important is to recognize is that the impact of child sexual abuse can vary from person to person, and it may be influenced by factors such as the severity and the duration of the abuse, the age of the victim, the relationship to the person who's perpetrating or abusing, and the availability of support services. So, addressing child sexual abuse requires a comprehensive approach that includes prevention, early intervention, the trauma informed care piece, and support for survivors and their families. And that's what we're here to discuss, the early intervention piece, which has great ties again with prevention practices as well. So, looking at early intervention and support services and the crucial role that it plays in addressing child sexual abuse and mitigating its impact on survivors and families, there are several reasons, right, for it, the importance. And first and foremost is minimizing further harm. So, early intervention can help stop the abuse from continuing and prevent additional trauma to the child. By identifying and addressing abuse at an early stage, it's possible to minimize its duration and severity. We have there as an important factor of these services promoting healing and recovery. So, providing support services early on can facilitate that healing and recovery process for survivors. Access to counseling, therapy, and other mental health services can help survivors cope with the trauma and develop healthy coping mechanisms and rebuild their sense of safety and trust. What it also does is prevent long-term consequences. We mentioned just in the past slide, child sexual abuse has long-lasting consequences on survivors' physical, psychological, emotional, social well-being. Early intervention can help mitigate these effects and prevent them from persisting into adulthood. And by addressing the trauma early, there's a better chance of preventing or reducing that long term mental health issue, such as the PTSD, depression, and the anxiety. What we're also able to do with these services is empower survivors. So, these early intervention programs and support services provide survivors with the resources, the information, skills that they need to help to heal and recover. And this empowerment can help survivors regain a sense of control over their lives and build resilience in the face of adversity. Support of families and caregivers. So, child sexual abuse doesn't just affect the survivor, it impacts the entire family and support network. And programs like these include support services for families and caregivers, providing them with guidance, education, and resources to better support the survivor and navigate the challenges associated with abuse discovery and recovery. And then a big one, right? Breaking that cycle of abuse. Early intervention can also um, address the underlying issues within families and communities, and by providing support and education to families. And you're going to hear that a lot, the support, the education, the training, the community engagement. By doing that, it's possible to intervene early and prevent future instances of abuse. And then promoting prevention efforts. Early intervention efforts are integral to broader prevention strategies aimed at reducing the incidence of child sexual abuse. By addressing risk factors and vulnerabilities early on, it's possible to create safer environments for children and reduce the likelihood of future abuse. So, overall, early intervention and support services are essential components of a comprehensive response to child sexual abuse. I'm very thankful for APSAC for breaking down the different weeks because it does take us through that journey of prevention and reducing the incidences of child sexual abuse. And by prioritizing the early identification, the intervention, and support, we can ultimately better protect children, promote the healing and recovery of survivors, and work towards preventing future instances. So, when we talk about identifying the vulnerable populations and at risk families for child sexual abuse, it can be defined in several ways, right? Taking into account various factors that may increase the likelihood of abuse occurring. So, what you have on screen here, a few, broken down vul- um, information on those vulnerable populations. And first and foremost, it's children. All children are inherently vulnerable to child sexual abuse due to their age, dependency, developmental stage. However, certain groups of children may face heightened vulnerabilities based on factors such as, again, their age. Younger children, especially those under the age of 5, may be particularly vulnerable due to their limited ability to recognize and report abuse. Disabilities, right? Children with physical, intellectual, or developmental disabilities or delays may also be at an increased risk of abuse due to factors such as communication barriers, dependency on caregivers, and social isolation. LGBTQ plus youth, they face additional vulnerabilities due to stigma, discrimination, lack of support, and this can make them more susceptible to exploitation and abuse. And then foster care and residential settings. Children in foster care or other out of home placements may be vulnerable to abuse due to disruptions in caregiving relationships, lack of oversight, and limited support networks. When we look at marginalized communities, certain marginalized or underserved communities may face increased vulnerabilities because of systemic factors. And those factors may be poverty related, racism, lack of access to resources. So these communities may include your low income families, your communities of color, your immigrants, and your refugee populations, the indigenous communities, and rural communities with limited access to services. When we talk about at risk families, this refers to families or households where factors exist that may increase the likelihood of child sexual abuse occurring. So these risk factors can vary widely, but it could include family dysfunction. So dysfunction within the family, such as parental substance abuse, domestic violence, mental health issues, or parental incarceration. All of these can create environments where children are more vulnerable to abuse. Family stresses and conflict can also contribute to that increased risk. Caregiver characteristics. So, certain characteristics or behaviors of caregivers or family members may also increase the risk of child sexual abuse, and that could be due to history of abuse or trauma, right? Substance abuse or addiction, mental health issues. If you have untreated depression or anxiety, you might have a lack of parenting skills or knowledge about child development or just inadequate supervision or monitoring of children. These are all components of caregiver characteristics that can increase risk. Social isolation, families that are socially isolated or lack social support networks may be an increased risk of child sexual abuse, as there may be fewer resources or individuals available to intervene or provide support. We have community factors as well, right? So those community level factors like your high crime rates, your poverty, your lack of access to quality education or healthcare, the limited social services, all of these can contribute to increased risk within families residing in these communities. So, identifying vulnerable populations and at risk families is essential for targeted prevention and intervention efforts aimed at reducing the incidence of child sexual abuse and providing support to those most in need, right? We have to identify who is at risk to be able to then provide the resources, look at where the gaps are, look at what the needs are to then minimize, mitigate any of the incidences that could occur. So addressing those underlying risk factors and vulnerabilities, we're able then to create safer environments for children and families and promote their well-being. So what does that look like in terms of outreach, right? So identifying and reaching out to vulnerable population, it requires that multifaceted approach that involves the collaboration among various stakeholders. which would include your community organizations, your social services, healthcare providers, educators, law enforcement, and some strategies for effectively identifying and reaching out to vulnerable populations would include what you see on screen. So we have community outreach and engagement. What does that look like? It might be establishing partnerships with community based organizations, your religious institutions, your schools, and other local entities to reach vulnerable populations. It might mean conducting outreach events, right? Your workshops, educational sessions in community settings to raise awareness about child sexual abuse, its risk factors, and available resources. It might entail utilizing culturally sensitive and linguistically appropriate materials and approaches to engage diverse communities. You will again see training and capacity building throughout. We need to provide the training to professionals and frontline workers, your social workers, your healthcare providers, educators, law enforcement. So you see, it's repeated, right? All of these different touch points within the society. If we're looking at changing on a system level, then that's what we need to do. And we're looking at providing that training that might be on identifying signs of child sexual abuse and working with those vulnerable populations. It might mean offering workshops and seminars on trauma informed care, cultural competency, and effective communication skills to enhance a professional's ability to engage with the vulnerable population sensitively and effectively. We see there too screening and assessment. So what does that mean? It would look at incorporating screening tools and protocols into routine visits. So you might have routine healthcare visits, you might have visits to educational settings and social services interactions. So with those tools and protocols, you're able to identify families and children at risk of child sexual abuse. It again will entail training professionals to recognize risk factors and warning signs of child sexual abuse, such as the changes in behavior, the unexplained injuries, or inappropriate sexual knowledge or behaviors. Then we have technology. So, establishing or sharing out the helplines, the hotlines, the online platforms where individuals can report suspected cases of child sexual abuse anonymously and seek support, and utilizing technology and social media platforms to disseminate information about available resources and support services for vulnerable populations. Because the reality is, we all sit in our particular sphere of influence. When we utilize strategies like this, what we're doing is maximizing our reach, maximizing the impact possible, right? You're reaching out through, for instance, here, the technology to a different audience that has a different sphere of influence who can then carry that message and carry those resources further into an area that we personally may not have that reach and that influence. Home visitation programs, right? Implementing home visitation programs that provide support and education to families with young children, particularly those facing multiple risk factors. Again, like those factors of poverty, substance abuse, or the parental mental health issues, and being able to train. Again, that word train home visitors to assess family needs and provide the parenting support and connecting families with appropriate resources and services. And a big one, collaboration, right? Collaboration and information sharing, establishing those networks and multidisciplinary teams involving social services, the healthcare providers, law enforcement, educators, and community organizations to share information and coordinate responses to child sexual abuse. And this is what you all are doing here, being part of this presentation as well. It's an opportunity to network and to create that prevention oriented community within this group of experts to be able to then collaborate even further and share out that information and maybe even look at those protocols that some groups might have and others are working on, agreements for information sharing and referrals across agencies to ensure that seamless support for vulnerable populations. And then trauma informed. This has been there's been a huge emphasis on trauma informed approaches. And what we're looking at is really adopting trauma informed approaches in all interactions with vulnerable populations, recognizing the impact of trauma on individuals' behavior, their emotions, and their responses to services, and being able to create safe and supportive environments where individuals feel empowered to disclose abuse and to seek help without any kind of fear of judgment, recrimination, or retaliation. So by implementing these strategies, communities can improve their ability to identify and reach out to the vulnerable populations, thereby enhancing early intervention efforts and preventing child sexual abuse. So collaboration, community engagement, trauma-informed approaches, they're key principles underlying the effective outreach initiatives. What I want to do is take a minute to talk more on Darkness to Light's work within some of these key areas. So, namely, the community engagement, the training, capacity building, collaboration, and being trauma informed. Because what it is really like an example of what early intervention program could bring and how it utilizes these strategies, how it utilizes these audience gaps that need to be addressed in an effective way. And what I want to start with is our theoretical founding, which is our social behavior change framework. So we use a social behavior change framework to guide work in preventing child sexual abuse. And social behavior change is a proven approach for enabling changes at individual, community, and societal levels to improve the health and overall well-being of everybody, right? So what we work towards is having adults throughout society actively preventing child sexual abuse within their sphere of influence. So our work looks at activating four main audiences. We look at adults with political power and social influence. We look at adults in the community, adults in youth serving organizations, and adults in the family. Now we know that even you sitting here in this session, you're wearing many hats, right? You might straddle some of these different audiences, and that's fine. What we do is identify the specific audience to activate at various societal levels, and then address the range of individual and social factors influencing willingness and influencing the ability to take action to prevent child sexual abuse. A lot of words, right? So, like, just to break that down, if we're looking at, for instance, addressing adults in a youth serving organization. It might be with a school, right? It might be with new teacher orientation. And the needs of a new teacher might be very different from, let's say, a state representative, right? Or it might be very different from even a veteran teacher. So we meet that person where they are to provide them with the resources needed to activate the behaviors that we want to see. The recognizing the signs, the reacting responsibly, and providing that through training. So that's a quick overview of the theoretical underpinnings of our work. And what I do want to share as well is actually the curriculum, how we build that curriculum and what we build it from. And if you notice, it will link to a lot of those qualities and those components that tie into successful early intervention programming. So first and foremost, we start from a place of power. We invite different audiences to make choices that will protect children, be ready to take risks, to minimize dangers to children, and to support one another. And our curriculum is focused on the 5 steps you see on the screen there. It's about learning the facts. It's about minimizing opportunities for abuse to occur. It's about talking about the issue, talking about safety, boundaries, healthy touch, active bystanding. It's about talking with other adults and talking with children. And these two steps 4 and 5 particularly fit into that early intervention piece, which is recognizing the signs. So recognizing the signs of grooming, of manipulation, any red flag behavior, and also the signs of abuse, and then reacting responsibly. So stepping in if boundaries are being violated, making a report, responding in a trauma informed way. So that's what is built into this particular program. It's an example of a training that incorporates some of those strategies we talked about earlier and can be used as an early intervention tool. Our flagship program is Stewards of Children. It is evidence informed, it's award winning, it teaches adults to prevent, recognize, and react responsibly to child sexual abuse. Now, I'm not saying that there aren't any other intervention tools out there. There are. And from darkness to light, I'm a curriculum designer. I trust what we've done, and it's very much backed by the evidence, it's backed by the research. We use interviews with a very diverse group of people with lived experiences, the experts, treatment providers to teach. And through that training, we're teaching adults from those different spheres practical actions that they can take to reduce the instances of child sexual abuse in their organizations, their families, and their communities. What sets us apart is we're one of the only evidence-informed adult-focused child sexual abuse prevention training in the US, and that has been proven to increase knowledge and change behavior. Now, I do have a pet peeve with a lot of the tools out there, and if you are researching some of those tools to see if it's applicable to your context, your community, your organization, I say to do so with a good eye to those marketing pushes that people do. So they like to say, "Oh, evidence-based is better than evidence-informed," and a lot of the time, some of those programs are not really evidence-based. To be evidence-based, you need at least two randomized controlled trials, and sometimes those don't exist, but the words exist that is tied to the program. We're not gonna, we have research that has been done that shows a change in behavior from the time from point A to point B with that intervention tool, but we're looking at being authentic to what we do and having it designated as it needs to be, which is evidence informed. It's delivered in a trauma informed way, and you would notice that's part of what we're going to discuss today, which is why I'm focusing in on this as an example. And it features powerful videos paired with that facilitated piece. That discussion, that unpacking, that debriefing after this training is after the video is shown. So we have a train model. So again, we think about where we sit in our sphere of influence, right? And having those trainers have access to communities that we might not have access to. So they're able to bring that education, that training, the resources that we've just talked about is needed to those communities that might be close to us, and equipping the adults with influence within those communities is essential to bring those tools within those different areas. Having spoken of Stewards of Children as an example, there are things that we need to look at in terms of strengthening existing programming and, um, first and foremost, increase funding and resources, right? We can't do anything without money. Some of the strategies for strengthening these programs will involve increasing the funding and resources. Unfortunately, that means advocating a lot for increased funding from government agencies, philanthropic organizations, private donors to support program expansion, staff training, and service delivery. It's a hard space to sit in because if you do your work well, nothing happens, right? Like prevention is a space where you don't see something um, happening. We want it prevented. So to measure that becomes difficult. So sometimes having those conversations to advocate for the increased funding gets a little tricky. Um, but it's great that when we have like-minded people in positions of influence to make those decisions, it makes every one of our jobs a little easier in that regard. And our job really is to bring that awareness out. Um, Seeking grants and funding opportunities specifically targeted towards child sexual abuse prevention and intervention programs will be crucial for strengthening existing programs, expanding outreach and accessibility. So conducting community outreach efforts to raise that awareness that I talked about available services and reducing the stigma around child sexual abuse. You could possibly establish satellite or mobile service locations to reach those underserved populations, right? Which would include rural areas and those immigrant communities and those communities of color that we identified earlier on as vulnerable communities. Some things simply as providing transportation assistance and language interpretation services that would help improve access for individuals with limited mobility or language proficiency. So all of these are things to think about when we're thinking about strengthening and increasing the impact and the outcomes of existing programming. Again, staff training and development. So offering that ongoing training and professional development opportunities for staff members on trauma-informed care, on cultural competency and evidence-based interventions, and providing specialized training for staff working with specific populations, such as children with disabilities, LGBTQ plus youth, or immigrant families, and even implementing, and this is a big one, and we tend not to pay much attention to it, but implementing strategies to support your staff wellness and preventing burnout. We can't take care of others if we're not taking care of ourselves. So what does that look like? Is that going to be peer support groups? Is that going to be self-care workshops? You know, It's not going to be mental health days that you totally disconnect from the work that you do. That is going to be important as part of strengthening existing programming. Integrating that technology and innovation piece again. So utilizing technology to streamline delivery, to improve data collection and management. Remember, we say a lot of those funders won't fund if you don't have the data. And we can't have the data if we don't have those protocols and processes in place to be able to collect it well, effectively. And being able to enhance communication with the clients would help strengthen those programming efforts. Developing online resources, webinars, educational materials to supplement in person services and reach individuals unable to attend in person sessions. Um, so for instance, for us, right, we have different modalities of the resources and training that we offer. It might be online, it might be virtually facilitated, like you and I are in this virtual room right now communicating. Um, or it might be in person, or it might be a combination of each one of those modalities. Strengthening collaboration and coordination, fostering partnerships among local service providers, community organizations, government agencies, and other stakeholders involved in the child welfare and trauma response, again, will be key to strengthening existing programs and establishing formalized referral networks and information sharing protocols to ensure that seamless transition between services and continuity of care for survivors and their families. And again, it comes up a lot, the multidisciplinary teams or task forces to address the systemic challenges and identifying opportunities for collective action. Evaluation, improving program effectiveness, also crucial for strengthening your existing programs. So looking at assessing the impact of services on client outcomes, satisfaction, and well-being. And listen, if there's one great core value to adopt is a growth mindset, because sometimes things just don't work and you don't know it doesn't work well until you do an evaluation and assess, and then you're able to pick back up and look at the feedback that you need to improve on what you have, and that's not a bad thing. So that continuous evaluation and assessment piece is going to be critical. Collecting and analyzing that data on service utilization, on your client demographics. Who are you, expecting to reach? Any barriers to access, to identify those areas for improvement and to inform strategic planning and getting that feedback from your clients, your families, your community stakeholders, right? It takes a little time, but it is so crucial to have something that works well, that is relevant to the audience that you are, or the community that you're serving. And then continuing to advocate for policy changes and systemic reforms, right? So, by implementing these strategies, existing early intervention programs and support services can enhance the capacity to meet the complex needs of child sexual abuse survivors and their families, to promote the healing and resilience that is necessary, and to contribute to preventing future instances of abuse. All right. So you all are keeping me honest here. I'm doing a quick check-in at this point to ensure that, one, I'm being held accountable to what I communicated we would be doing earlier. So we've identified the factors that make populations vulnerable and that place families at risk. We've talked about how to strengthen early intervention programs and support services. And now we're going to look at trauma-informed peace and collaboration. Understanding trauma and its impact on survivors of child sexual abuse is essential for providing effective support and intervention. Trauma refers to any deeply distressing or disturbing experience that overwhelms an individual's ability to cope and disrupts their sense of safety, their security, and well being. Trauma-informed care is critically important in supporting survivors of child sexual abuse and their families for several reasons, right? Safety and trust being one of them. So creating that safe and supportive environment, survivors feel validated, respected, and empowered. And by recognizing the impact of trauma on survivors' sense of safety and trust, trauma-informed practitioners then strive to minimize that re-traumatization and promote feelings of security and stability. Understanding trauma responses, right? So understanding and validating the trauma that a survivor may have had in their responses, and including their emotional reactions, coping mechanisms, and behaviors into that understanding, right? And acknowledging the validity of the survivor's experiences and responses. And through doing that, practitioners can foster that non-judgmental, empathetic, therapeutic relationship that would be key in approaching with a trauma-informed lens. Reducing re-traumatization. So we always seek to minimize the risk of re-traumatization by avoiding practices, environments, or interventions even that may inadvertently trigger survivors' trauma responses. So practitioners are trained to recognize potential triggers, respect survivor boundaries, and provide choices and autonomy in their care. We have empowerment and collaboration, a holistic approach, cultural sensitivity and responsiveness. I'm looking at my time, so I'm trying to get the information across without being too verbose. Resilience and recovery, prevention and advocacy, right? So overall, trauma-informed care is essential for creating a compassionate, empowering, and effective response to child sexual abuse. And by integrating trauma-informed principles into service delivery, practitioners can enhance the safety, well-being, and resilience of survivors and their families and contribute to healing, recovery, and social transformation. What I'd like to do is share 10 minutes of um, Stewards of Children, that flagship training, because what you can see within there are the elements that help with a trauma-informed approach from more of a design aspect. So I don't know if some of you all are in here that also work on training, build training. Some of the things that we look at when we built our training was simple things, right? Simple things as the use of music within it, the use of natural spaces, natural scenes to de-escalate someone as they're processing information across the scene, across the training video. We look at, again, information that is coming from a place of power, a place of you can do something, which is critical, again, with early intervention and prevention programming, because you do not want someone to feel like overwhelmed and this is too much and I can't do anything. That is very against what we're wanting to do, train all of the professionals and hit all of those pieces that we talked about. So I'm just going to share that. Oops.
At Darkness to Light, our vision is a world where adults proactively keep children safe from sexual abuse and work together to form prevention-oriented communities where every child feels loved, protected, and nurtured. What you experience today may not be easy, but by applying what you learn here, you can protect a child's right to grow up healthy and safe with their sexual boundaries intact.
You have the power.
You have the power
You have the power
to break through ignorance.
to dismantle stigma.
To increase accountability.
You have the power
to address a root cause of social problems.
Like violent crimes,
Homelessness.
health problems.
Childhood pregnancy.
Substance abuse.
You have the power
To increase individual and community faith in the systems that protect our children.
Or to change those systems that are broken.
you have the responsibility
to preserve innocence.
To protect the well-being of a child.
When you prevent, recognize, and react responsibly to child sexual abuse,
you show your dedication to creating a community
where courageous decisions can be made.
And innovations in child protection can thrive. At the core sits a child, and that child's healthy development is in your hands.
Perhaps you have multiple roles you play.
You may be a family member,
part of the community.
You may work in a youth-serving organization,
or are a social or political influencer.
You are responsible for protecting all children in all your spheres of influence.
Are you ready to be agents of change?
Will you be empowered to act?
Become empowered with us. Let's make choices that protect children.
Take risks that minimize dangers to our children.
Support each other.
Preventing child sexual abuse happens through the choices we make. Making the right choice isn't always easy or comfortable, but if we want well-adjusted children living life to the fullest, then we must make proactive choices that prepare and protect them. This training is about those choices.
Looking back, what the social worker and the doctors, even the doctor overlooked it, the teachers, they made an assumption that I was just being impulsive. I don't think back then they were trauma-informed. And so a lot of things went misdiagnosed, overlooked, because they're just thinking it's just normal. You know, we got this kid that's acting out. I just wish someone had just asked me, what happened? What's wrong? And I could have let it all out, but not one of them asked me that question. So looking back, that's what I wanted, to be heard.
If you are watching this, there's obviously good reason for it. It likely means that you're someone who is uniquely positioned to make a difference in your community, in your family, in your society, in your town. It could also mean that you're a survivor, and someone who's watching this for the purposes of their own healing, to try and build up some of that hope and resilience moving forward. All I can say is never underestimate the value of a single encounter. If you take this training and you have the ability to make a small difference in one person's life in the way that you would have least expected, bear in mind that you will never know the impact that you are having on that person's life because you have made the decision to share. I know for certain that I am where I am today because people made choices. People made choices that it's not humanly possible for them to know that I would have been the beneficiary of those choices. Yet they made those choices, and here I am today.
Almost every choice we make to prevent child sexual abuse or react to it involves taking personal risks. We may believe that taking risks is a bad thing, but by accepting and leaning into the discomfort, regardless of the outcome, we are minimizing danger to children. You may not be comfortable talking with children about sexual boundaries, or redirecting an adult who's crossing a child's boundaries, especially if it's someone you might know and trust, someone you're loyal to, or reporting child sexual abuse to the authorities. But these actions are a necessary risk that we must take to protect the rights of children.
My family virtually has shunned me because you tell what's going on in the house. You're not supposed to do that. It's none of no one's business. You're supposed to get over it. You're supposed to move on. You know, you're not there no more. Stop. That just didn't feel or sound right to me because I've been doing it. I have done it my entire life. And with me doing that my entire life, the damage that I've caused, not just to other people, but the damage I've caused myself, what I've taken away from myself.
For adults who might be hesitant to support, I would say to them that you could be the gateway to that child's freedom and safety and health and peace of mind. You could be the gateway by virtue of choosing to take a risk and make that report. You could be the only person who's going to help them get to the other side of that abuse. That has a ripple effect too, because maybe that perpetrator is abusing other children. So you can stop so much more than you even know. And honestly, as adults, that's the grown-up thing to do. That's our responsibility, to care for children. And particularly if you're in a role of trust, particularly if you are someone whom children spend their days with. You know them, you see them. You have to take that risk because you could be the only one who does. And if you do, when you do, you open up a whole different possibility of life and healing and joy for that child.
Fear and uncertainty can be reduced when we know we'll have support. By building a community that understands why preventing child sexual abuse is important, we are supporting each other's efforts in this vital endeavor and have a place to go when we need help. We can band together with common knowledge, just as you're doing right now in this training.
It's about people opening their ears and their hearts and listening to understand, not listening for pity, not listening to say, that was horrible and you're such an inspiration, but then not doing anything to change this horrible epidemic of sexual abuse that continues to impact generations and generations. If we're actually going to address the problem, it's all hands on deck.
Your choice to be here shows that you're ready to take risks to protect children and that you're ready to build a supportive community. Making choices, taking risks, supporting each other. These empowerment skills make it possible to carry out the 5 steps to protecting our children.
Okay, so I'm going to stop that there and continue. Oops. Because what you would have seen, and again, I'm showing this as an example of some of the components that need to be considered for trauma-informed training programs. One of it being understanding trauma and its effects, and so the education on the neurobiological, the psychological, and social impact of trauma on survivors' development, functioning, and well-being, and being able to translate that into a way that does not, again, re-traumatize or does not devalue those experiences, and building and strengthening programs that are early intervention programs, that are prevention programs, will be it's important to take those things into consideration in all of the design aspects, from the content to the delivery to the experts on screen, how that's presented. Some other things, as you see there, it's those trauma-informed care principles, right? So how do you build safety, trustworthiness, empowerment, collaboration, and cultural humility? You've heard within that, that few minutes, the empowerment piece, right, coming through. At least I hope you do. And then that collaboration, you have that common thread about it takes the whole community, and exploring those principles of trauma and care, trauma-informed care. So your safety, trustworthiness, choice, collaboration, empowerment, and cultural sensitivity. And on screen as well, you would see some more of those components, from avoiding the re-traumatization, the cultural competency and diversity piece, communication skills, your self-care. So all of that there are critical components of building trauma-informed training programs. And then with fostering collaboration and communication among different sectors, it is essential for addressing child sexual abuse effectively and providing comprehensive support to survivors and their families. And some of those strategies to do that are included there, right? Establish interagency partnerships. So what does a formalized partnership and collaborative agreement look like among social service agencies, healthcare providers, educational institutions, the law enforcement agencies, legal advocates, the community organizations that are involved in prevention, intervention, and support for survivors of child sexual abuse, and being able to create those task force or forces or working groups to coordinate those efforts and share information and address systemic issues. And there are models out there that are already working very well. So, looking into what works, what is not working, and how do we develop this that in a culturally relevant way for particular communities. Part of being able to foster that collaboration is facilitating those regular meetings and the communication aspect of things, scheduling it, honoring people's time, showing up, sharing updates, exchanging the information, discussing cases and challenges, right? We learn best when we learn from each other. Um, and implementing those protocols and procedures for sharing the information securely and confidentially among these agencies. And again, you see technology and data sharing platforms and providing that cross-sector training professional development. And it could be related to child sexual abuse topics. It could be related to trauma-informed care, cultural competence, a host of different skill sets that come from the different experts in the different fields to then train your professionals who are working in this field to foster that shared understanding of trauma and its impact, as well as the importance of collaboration. Having clear referral pathways and protocols, and promoting the interdisciplinary consultations and case reviews, and definitely engaging your community stakeholders and advocates. And again, you see coming back into play that evaluation piece, right? That monitoring piece to make sure that you're assessing effectiveness, that you're identifying those areas of improvement and measuring your outcomes. And by implementing these strategies, stakeholders can foster a culture of collaboration, communication, cooperation among different sectors involved in addressing child sexual abuse that lead to more effective prevention, intervention, and support for survivors and their families. One of the things that I wanted to point out again, we're all in this work to build that prevention-oriented community. And what is needed to create that is really the awareness, the training, the advocacy. Can't forget the funds, the fundraising piece of it. And the results of that would be that reduced stigma, the increased resources that are accessible to the groups that need it, the increased faith in the systems, right? Because many of us think the system is broken, and in some cases they are, right? So when we do those things on the left, the awareness, training, advocacy, fundraising pieces, and we monitor and we evaluate and make more effective our existing systems for early intervention and prevention, then that leads to that increased faith in the system, and it leads to increased accountability. I'm going to skip this video, which was on prevention oriented communities, and just end with checking off again accountability. We just talked about increased accountability of having looked at the presentation objectives. And then I know we have about 7 minutes for questions. And I just want to state too that if you do have questions, I know Hannah and I spoke that she's been recording all of those, and we will get you any answers that you need with the resources that will be shared.
Please put any questions in the chat or raise your hand and come off mute. We would love to hear from you. No questions yet. Oh, well, we got a comment. This was great. Thank you very much. Anyone want to share what they're doing around, Rhonda, you shared some really, really great points that we can do in April and really all year round to keep that prevention-oriented community going. We'd love to hear anyone want to share what they're doing in April or anything that stood out that you have a new idea that you can go continue throughout the year. See a hand raised. I will unmute you. Thank you.
Yes, hello. Yeah, my name is Abimbola. Actually, I'm calling from Nigeria. I'm based in Nigeria, but I studied in human services in university, Metropolitan State University in Minnesota about 20 years ago. So my question, yeah, it's not really a question, but more of an input. My organization, we are dealing with, we are trying to teach young children now to speak up against sexual abuses, especially by family members, which has always been a taboo here, and it's still a taboo here. Anytime a child has been sexually abused by family members, they will tell them not to talk about it. That do you want to be around do you want your neighborhood, your friends, your community to know that you've been sexually abused, that you are now a damaged good, that nobody will want to be with you in future. You will not be able to get a husband. And they do this thing to these young children. And we continue to have generation of damaged adults. And especially during this COVID lockdown, my organization, we saw a lot of young children. In fact, we saw the children between the age of 13 and 15 pregnant due to rape, I had to treat a case, a young girl who was going to school because during that lockdown, she had to go to school in the evening, and somebody accosted her. She lived somewhere in not really a remote village, but still outside. And like a farmer, a peasant, grab her and rape her. And we had to get involved, cancel her. She was worried. She was devastated. She was 15 years old then. And we got the police involved. The police, at the end of the day, they end up, turning the whole thing upside down. And that's another thing. We are now getting the police involved to stop sabotaging cases of sexual abuses, because they're actually our number one problem. When an NGO decided to take that case up and we go to the police to report a case, we end up finding out that the perpetrator usually go behind. If the perpetrator is someone that is rich and a family member, will go to the police authority and bribe them. And they end up leaving, just turning the case upside down, that they will just tell her, okay, why don't you go and settle this case at home? It's a family thing. It's not a family thing. It's a sexual abuse thing. And this thing will continue going on. So that's what most of this NGO we are now into. We are now going to primary school, teaching those young girls, speak up, even young boys. It's not just young girls who have been sexually abused also. We are not teaching them, speak up. Don't let anybody tell you that being raped is a secret. Any sexual abuse it is not. So that's what we are doing now. Thank you.
I'm muted. Thank you for sharing in the work that you're doing. I know we have 1 minute left. One quick comment. This model of making change for prevention is fantastic. Have you or anyone that you are aware of used this model to address other forms of abuse, such as elder abuse?
So we have not looked at elder abuse. We're firmly into the child sexual abuse area of things. We had a consultant in the first versions of Stewards of Children who does do some of that outside of, it's called Phoenix Possibilities. So she builds training that link to elder abuse.
Thank you so much. And if there are any other additional chats in the questions in the chat, I will share. I will note, someone said I'm a D2L facilitator. I must say this is one of my favorite trainings to give. There's just so much valuable information to share, especially being a prevention education coordinator. So thank you so much, Rhonda. For sharing more, I encourage you all to check out Darkness to Light, and you all will receive a copy of the presentation, recording, and materials. Have a wonderful day.
Thank you.
Thank you.
Thank you.